And our goal here was to expand access to primary care, expand primary care capacity, and reduce people's dependence on hospitals for primary care. I want to thank Tish James from Brooklyn for joining us. I think we all know too much money gets spent on expensive inpatient care once people get sick. Too many New Yorkers have the emergency room as their doctor's office, and not nearly enough money or attention gets spent on building and developing primary care in our city and getting New Yorkers connected to a permanent primary care provider. In December, a request for proposals will go out. In the request for proposals, we will ask organizations to respond to us about how they can expand primary care capacity in these 11 key areas. We will require that in their request for proposal responses, they also speak specifically to how they can eliminate or reduce the barriers that New Yorkers talked about. As I said, in 2007 in my State of the City speech, I said that we in the council wanted to expand primary care capacity. We wanted to deal with the reality that too many New Yorkers go to the emergency room because they can't find a doctor and they don't have a primary care relationship. This makes people get sicker before they get help, and in the end, it costs us far more money in our healthcare system. But we wanted to make sure that as we move forward with this primary care initiative, we did it right, and that we did it to the best degree possible in an apolitical way. That's why we've commissioned this study. This study which shows us the zip codes we need to expand primary care in, tells us where to do it and how to do it to make sure it works for New Yorkers